Review the steps needed for an arterial line sample or ART line. First, you want to review the patient's chart for a physician's order for an arterial line sample. The equipment necessary are clean gloves, hand sanitizer to sterilize your hands, alcohol wipes, a pre-heparinized syringe to draw the sample, a 10 milliliter syringe with the needle removed to draw the waste sample, and a piece of gauze for the excess waste.
The first step is to perform hand hygiene and implement your standard precautions. Here, putting on gloves. When you enter the room, you'll correctly identify the patient and introduce yourself and your department. You want to explain the procedure to the patient and confirm that the patient understands. Next, properly assemble the equipment. Open your 2 syringes onto a clean surface and assure that your sample syringe is pre-heparinized. First, grab a piece of sterile gauze and place it underneath the stopcock. Remove the cap and place it onto a clean surface. Take an alcohol prep and wipe off the stopcock to disinfect it. Aseptically attach your waste syringe onto the stopcock port. Turn the stopcock so it is off to your flush and so it is open from your patient to your syringe. Now, draw back your waste, usually around 5 milliliters. After your waste is drawn, turn the stopcock off to your syringe. Remove your waste syringe and dispose in a biohazard. Take your pre-heparinized syringe for your sample and aseptically attach it to the stopcock port. Again, turn it so it is off to the flush and open from the patient to your syringe. Draw back your sample. Again, when you're finished, turn the stopcock off to your syringe and remove your sample. When you're finished drawing the sample, verify that the blood sample contains no air bubbles or clots. Attach a patient label before sending it to lab. Now we will prepare to flush the line. With the piece of gauze underneath, turn the stopcock so it is off towards the patient. That way it's open from the flush to the port. Then, on the transducer, turn so that it is off and the flush is now open to the line. Now you will squeeze and flush the line so that the port is cleared out onto the gauze. Close the stopcock to the port. Now we will flush the line to the patient. Again, squeeze and flush until the red and all the blood is flushed through and the red becomes clear. When finished, turn the stopcock at the flush off. If needed, use another alcohol prep to clean off the cap and aseptically reattach it to the port. Dispose of all supplies and equipment and assure that your patient tolerated the procedure well. Move and dispose of your gloves and wash your hands. Make sure to document the procedure thoroughly.